Something that concerns every single one of us is healthcare, so by default, digital healthcare can change everyone's lives. That's why I want to talk to you about how Estonians have digitalized their healthcare services and what this means for the patients, the doctors, and the government. The legal groundwork was laid in the early 2000s, while the actual services started getting digitalized in 2007. Since then, all health records have been digitally available to the parties who require it as part of their job, primarily doctors and, to an extent, paramedics, nurses, and other healthcare professionals. So let's take a look at the patient portal that we have in Estonia. I can immediately see my insurance status as well as my family doctor, who is the go-to person if I have any questions. Then, there is a range of services that you can use. Under case summaries, we can see every single time that I've been to the doctor or hospital in Estonia. We can then click on those individual entries and see the doctor's findings. So here you have all the different things that your doctor wrote down. So the patient sees the entire analysis of him or herself. Is my stomach okay? Did my eyesight get worse? And so on. This information is also very helpful for when a patient gets transferred to another doctor. This new doctor can see the previous medical history, scans, and lab results. Going back one step, you might have noticed those green buttons on every visit. By clicking those blocks, you can specifically choose the summaries of your doctor visit and make the data inaccessible. This is a very simple way of making people aware of what data ownership means. Owning and managing your data should be made accessible and easy to understand. Going beyond this, I can also see who has looked at my medical data via the logbook system. This helps me protect my data. And healthcare professionals who are found to have looked at medical data illegally face serious sanctions. Again, this creates a lot of transparency aimed at those who treat and use our most personal data. This level of transparency is unheard of in most countries with legacy systems and paper trails. Just think about it. Do you know who has looked at your medical data in the last 5 years? These added transparency options make the system more accountable and help people trust the e-Estonia architecture. Another cornerstone that I have mentioned in the video about interoperability services is the e-prescription service. To recap, I can use my ID card to go to any pharmacy in the country and get my medicine. No paper prescription required. You could also get the medicine for a relative if they are too ill to get the medicine themselves. This solution doesn't even require any IT skills whatsoever. It just makes everyone's lives easier. Also, the doctor can renew your prescriptions digitally, which makes things easier for recurring prescriptions. It takes doctors no more than 15 seconds to renew a prescription. We've actually measured it. Obviously, you can also see information about your prescriptions on the patient portal, including how often you should take the medicine, how much it will cost, when the prescription expires, and so on. In connection with this, some pharmacies allow you to order prescription medicine directly online or get it for someone else. What if you're ill? Well, then your doctor would issue a digital sick leave note to the medical database, which would be transferred to your employer, who then has a trustworthy proof of diagnosis. Of course, your employer does not see any of your medical information. Another important factor are health declarations. You might need them in order to receive a driver's license or register for military service. As you might have expected by now, these medical certificates are also digital, so the respective responsible authorities can just check whether you have a valid certificate or not. Let's talk about another extremely fundamental healthcare-related service, the birth certificate. In most countries, they're still printed on paper and issued by the local hospital. Usually you have to ask for several copies because you need to prove to several authorities and institutions that you have indeed been born. In Estonia, birth certificates are of course digital. The doctor administering the birth registers the birth of a child with a brand new and unique personal code, and then connects that code to those of the parents or other guardians. From that day onwards, parents can access health-related data of the child via the health portal. The various government authorities that require this birth certificate just send a query to receive it from the medical database. Should one of our loved ones unfortunately pass away, you would also get the death certificate online. The system also compiles data for national statistics so that relevant ministries can measure health trends, track epidemics, and make sure that national health resources are spent wisely. One useful application at the top left is time-critical services. What are those? Well, if you have an accident and call the emergency hotline, you can tell them your personal code, and the paramedic who's on the way to the scene of the accident can see your blood type, what allergies you have, and what medicines you're taking right now. That way, the paramedic can determine what is the right treatment for you and what medicine should be avoided because you might be allergic to it. This very simple can change and, occasionally, even save lives. Another very useful tool is the Estonian Medical Digital Images Bank. This data repository is integrated with the Estonian Health Information System and stores almost all radiological images and films from MRT, CT, EKG, X-ray scans and more. Additionally, generalists can consult with specialist doctors, which reduces the need for more specific research or even patient movement. This technology greatly improves treatment quality in smaller hospitals and regions, and of course it also saves time for both doctors and patients. Just like with every other topic, the digitalization of the healthcare sector is never complete. Estonia is currently implementing measures to move towards predictive and personalized medicine, which will improve the landscape of Estonian digital services even further. So, there you have it. Digital healthcare services are an integral part of the streamlined system of e-governance in Estonia, and they save a lot of money, time and stress.